Okay, welcome to Friday Facts. It is fabulous to see you all and to start Friday Facts. We have a wonderful guest, and I'm excited to talk with Hunter of the LGBTQ Center of Durham. But first, it is November 10th, which means Monday is November 13th, which means it is the beginning of our Joining Our Voices virtual symposium all next week. Monday through Friday, we have exciting online virtual sessions, Monday through Thursday from 8:30 to 9:30 and Friday from 11 to 12. For those who wonder, we do 11 to 12 on Thursday since that is our general monthly meeting time, but please join in. And if you are joining us right now, it means you have this Zoom link, and it's the exact same Zoom link for Monday through Friday. So please join us for the second annual Joining Our Voices virtual symposium. Okay, I want to get going. I am so excited to have Hunter here. Hunter is the health case manager for the LGBTQ Center of Durham. Lovely to have you here on this Friday morning, beginning of Veterans Weekend. Welcome, Hunter.
Thank you.
Okay, we have a tradition on Friday Facts. We're going to dive in all about you and the LGBTQ Center. But first, we always like to ask a little bit about yourself. Tell us a bit about your background, where you're from, and what brought you on this path.
So I'm originally from Ohio with Appalachian roots, and I got my master's of public health in 2015. I also have a background in psychology and sociology, essentially. Um, let's see, what else? I'm trying to think. I'm sure that there's a lot of things I could share, and I don't know how to. Um, I have a precious dog who is sitting right next to me, taking her mid-morning, or I guess second nap of the morning. Um, so she's just rolling her eyes. Uh, I moved to Durham about 4 years ago, a little over 4 years ago at this point. Um, and I've been working at the center for just as long. I moved here August 2019, and I started with the center November 1st, 2019.
Wow, you got connected with the LGBTQ Center. I've been involved with the LGBTQ Center of Durham longer than that. I remember going to events, and I had well, we'll talk about my own drag bingo party, my
Oh yeah,
50th.
I've heard about a lot of those.
Yeah, during the pandemic, we did a Zoom drag bingo party, and we had and the money that was raised or went to support the LGBTQ Center of Durham. There's a lot more we'll talk about offline, but I want to talk all about you. I'm glad that you mentioned, because I was going to ask about, selfishly, your master's in public health, which I have as well. So I was excited to see your MPH and wondering, kind of going into your work around health advocacy and support work within the LGBTQ plus community, and how that links with your MPH and your public health work. I'm always excited to find other public health members in this space.
Oh
So
yeah. When we see each other in the wild, it's just like, you have it too. Yeah. So let's see. I've always for as long as I can remember, I've definitely I've identified as queer, and I was in a lot of groups even in high school with like what is it? It's now called QSA, Queer Straight Alliance.
yes.
And I was very vocal about advocating for others. And so I don't know, I'm always good at like telling a story. And I was actually so before I started in this role, I was a statistician.
Oh,
And I know that that's kind of intimidating because people are like, why would you do this to yourself? And I'm like, because the numbers tell a story. And from there, you can really interpret a lot of things in a way that's able to communicate with others across different playing fields. And so I was communicating details on the federal, state, and community/grassroots level. And I found that I had a lot of passion for working in more of the grassroots and community level. I've worked in hospitals before, and in a lot of places where I needed to advocate. And I always knew that I wanted to come back to working in my community and working with folks that I'm like, let me use some of my experiences to work with folks. And that was actually when I got into public health. They asked me, like, why do you want to be in this program? And I said, because I want people that look like me to be able to trust me. Like, that's very important when you're trying to work with folks in the community, is like seeing yourself reflected in those spaces. And yeah, I when I first started at the center, I was actually in a role that was very different from where I am now. I was the program coordinator, and so I did a lot of the like overall coordination of a lot of the things that we do. However, I got shifted into health case management role because folks were like, "Well, you have an NPH, and like, it health is a privilege. Health is also a barrier and a hardship for marginalized groups, LGBTQ plus included." And from personal experience, I was like, "Yeah, absolutely, this makes a lot of sense." And navigating through different healthcare institutions on a professional and a personal level, as someone who also lives with chronic illnesses, I do see that as a privilege on my end, that I have a lot more of that navigation than, say, a lot of folks would. I also come from a medical background, from both of my parents. And so I was just like, let me use this knowledge and the language and like where I need to go and with whom I need to speak in order to make these connections for folks that, we are disproportionately unable to access services.
Okay, there's so many follow-up questions, and I'm torn between going down deeper about Hunter and your motivation and the way that you weave in your health advocacy and your statistics background into your work, and that of the LGBTQ Center of Durham. So why don't you kind of tell us a little bit about the services and the programs and the mission of LGBTQ Center of Durham, and then I think I'm going to weave back to you because you've added a few points I really want to focus on more. But why don't we talk about the big picture of the center, and then we're going to get back to you.
So from the beginning, the center was seen as an organization to be like a family room, or like a meeting space for folks to come and feel safe and affirmed in places that frequently aren't available to our LGBTQ plus folks in the community. And Durham is incredibly queer and incredibly trans and incredibly like in so many ways that we haven't maybe seen in other spaces. And I also say that as someone that came from somewhere where there wasn't that social justice lens that was incorporated within being in the LGBTQ plus community. And so we have a lot of those things situated with like even just the beginning, like of how the LGBTQ Center of Durham was created and developed, and the brainchild for it. And um hi, Shane. I saw Shane's message just pop
I
up.
know, Shane.
Good morning.
We're so excited, Shane, you're here. And I've got a question from Shane in a moment, but go on.
Yeah, yeah. And so it fits in so well once a lot of the things that were visible about where some of my talents are, with being able to go out into the community and create community-led and community-run events, but also to work on individual levels, because I also did a lot of event planning and organizing in previous roles. And so I'm just like, okay, this is where we need to go for this. This is where we need to go for that. And like I always describe like that I describe myself frequently as like I'm probably just three raccoons inside of a person's like a person's suit, because I'm really good at like just kind of like gathering resources from things. I'm just like, oh, I can use this. Oh, I can get this. Or oh, I just met this person while I was like, and no joke, climbing up a tree. I just seriously, I was like picking pecans and just ran into somebody who's like, actually, we could really connect on this way. So yeah, it's just a way of being personable, has created means for me to open up doors.
Well, that's wonderful. And you clearly sound like a connector. I appreciate that from one to the other. So then your title is health case manager. So you talked about doing big picture events and programs as well, or group events and programs as well as individual. What does that look like at the LGBTQ Center? What kind of health case management is needed on the individual or is offered on the individual level versus or in addition to the group level?
So on an individual level, I have typically between 5 and 10 clients at a time. And from the introduction, I will introduce myself in an email and I'll send out my health intake form, which has a slew of questions to figure out like, okay, where's the baseline? Like, what are we looking at? What are you needing? What ways can we advocate for you? Do you need an interpreter? Do you need like what kind of health case management? Like, what does that look like for you? Do you need access to a primary care physician? Do you not have insurance? Do you need to get some glasses? Do you need to be connected with a dentist? So I mean, it's literally it's a long list of different ways that I've experienced some disconnect or hardship, but also from what I've read in literature about ways that I think about it as ways of like people of color are marginalized for different health services and what LGBTQ plus folks are marginalized for health services. People with disabilities are marginalized for health services. And I took a lot of those different facts in creating this intake form to be like, okay, these are the things that you clicked. And then I put those in a spreadsheet. And I'm like, okay, from what you answered here, I have all these things like laid out on the spreadsheet. Then I talk with the folks at I talk with the person like a follow-up virtual meeting in person over the phone and kind of get a sense for who they are because once again that really helps with understanding like the pace of how we should go about things, creating an order of priority for certain things. So say if somebody's like, well, I need some glasses, but I also have like a really bad toothache, I'm like, "Maybe you should work on the dental thing, like calling somebody right now, and then I can schedule you an eye appointment with someone that I know that does free eye exams and free glasses." So yeah, it's a very individualized approach, but also helping them to create autonomy. So based on what they need, somebody may want a specific type of healthcare provider. So I know for me, when I first moved down here and I was looking for a primary care provider, I wanted somebody that was a Black femme. I
Mhm.
wanted somebody that was going to be able to be like, okay, this is somebody that's not um it takes away a certain level of trying to introduce yourself if somebody already understands like what certain hardships are, what certain um was it comorbidities, so like the increased risk of chronic illnesses and stuff and certain things like that. um and so I've had folks sit down with me and I'll ask those questions and they can give me some great feedback. And I'm just like, well, what does healthcare look like for you? And so then I craft the rest of the spreadsheet to be like, based on what we're talking about, here's some resources we can start from. And I'll sit there with them if they want me to while they look through the resources and put what they want together. Or if they ask me like, hey, like for the free eye exams, I'll be like, okay, I can call this person for you. But I like to make sure that they're in charge of their health journey, and ongoing enthusiastic consent is also a huge component of what I work in. I practice enthusiastic consent in like my personal and my professional life, and this is no different because that's another way of providing bodily autonomy to someone when you're working with them and you're like, hey, do you want me to do this thing? Do you want me to call this person? Do you want me to help you in this way?
I
Um,
love that term, ongoing enthusiastic consent. I work with clients as well, and I'm like, that's a great point. You're not just agreeing, but you really agree. You're really saying, yes, help me with this. I had no idea the level of individual support that the LGBTQ Center of Durham provides. So that's amazing that you do that and that that's offered for folks. I'm going to ask a question, and then I
Sure.
know we have folks listening and they are welcome to introduce themselves. People are starting to do that on the chat. And then also feel free to ask your questions. But since the famous Shane Lucas has joined us, and I'm going to ask a question, or when you and I were first introduced, Shane said, have Hunter talk about the intersectionality of identity, disability, chronic disease, as well as racial equity. And I know that's a lot there. That's a huge component.
I
But
never expect any shorter of a question from Shane.
I know, right? So he makes it real. And thank you, Shane, for that question. Or that introduction, and you shared just a little bit about your own, that you have your own issues. Clearly, we're the North Carolina Serious Illness Coalition, so that overlay of our identities as well as chronic illness and serious illness. And so how does all that intersectionality play out in your personal work, if you want to share that, but in the professional support that you provide at the LGBTQ Center?
So there's a couple components to that. Like right now, I'm working on the 2023 Community Health Assessment with Durham County, and we work
Mm-hmm.
on specifically the LGBTQ plus health section. And my particular section, in partnership with another really great uh, leader in the community, is on barriers to healthcare, barriers to access.
Mm-hmm.
And essentially working on those things, we in the literature, even there's so much missing information, and I mean this on like a large scale, of what barriers are limited, but also what means are being included in health research for LGBTQ plus individuals and communities at large. um, and so, it creates the disparity of like, well, we don't have a lot of information to go off of, or we're only going to emphasize these big points, like say smoking or HIV, and taking away from the fact that yes, and there's also other components, that we are individuals, we are people, we deserve to have health rights. We are we live with chronic illnesses. We um, have, me personally, I have horrible eyesight. um, there's other disparities that come with financial or economic, maybe health literacy, access, based on if you're in rural areas. So considering all of those things is really important when we're talking about health outcomes, and health outcomes on every level that we talk about. Yes, they need to be on and like in a group basis for LGBTQ plus folks, because there are marginalized differences that make certain health outcomes even less beneficial, I'll say. But also because like our health outcomes should be considered in the grand scheme of things.
Well, and I was thinking here, as a coalition, we have a focus on health equity. I know some of our partner coalitions do as well. And sometimes you even see it siloed within the health equity space. You see racial equity, and then you see LGBTQ plus equity issues. And you're doing work, and then there's issues around those with chronic diseases and equity for those who um, live with chronic issues as opposed to sort of acute issues. And you seem to, I'm playing with my hands, you seem to
It's
weave
okay, I
through
do the same thing.
I know, all three of those spaces. And so I love that you have a very formal platform now, not just through the center, but through Durham County, through the community health assessment. How do you weave that in and bring to a broader audience, especially with the community health assessment, both private and public and government partners, to really recognize the issues around health equity and even social justice and issues within that?
I think I know a lot of that passion comes from personal experience. When you live in the truth and you're talking about the truth, it just becomes second nature to be like, these are the things that we're not talking about. These are the things that I've been yelling about for years. And to finally have a place where I feel safe and supported in both the community level as well as at the center has really been uplifting for me to also dive deeper into those means. And I think just even on a professional level, I've navigated through a lot of those spaces um, for at least the past 10 years. And I think it just makes it easy for me to do that. And unfortunately, also because with having to mask in certain groups, it makes it difficult to combine all of those different facets in certain spaces. But I think as I've gotten older, it's been easier to just be like, you know what? You're going to hear the full story, and if you have a differing opinion, we can talk about it. That I think that that's also part of the important components of having these difficult conversations is listening to things that may be different from your own personal experiences or your own personal views. Because if you're going to just tell people you're wrong, um, sometimes that doesn't have the effect on change that you want it to.
Hmm. Well, and it strikes me that you can speak a few different languages are not the word, but you can use different perspectives. The statistician in you, the public health professional in you can use data points to those for those whom are motivated by that, and then your own personal experiences for those who are motivated by that, or those experiences of the participants and the clients of the center. So it sounds like to me you have lots of different ways to help broaden understanding. I want to respect for a moment what's happening on the chat line because some things are coming in. So you're already having a fan club. Folks want to know how they can follow you on social media. Do you have a social media presence, or does the LGBTQ Center where?
So the center does, yes. And I do personally, but I mean, I'm a photographer when I'm not working in this role, so I don't think people really want to follow that. It's, you know, but yeah, our social media for the LGBTQ Center of Durham, I believe our Instagram is LGBTQ Durham. And then we also have our Facebook presence, which is if you just put into the search, it'll pop up our page. And then we also
Okay.
have our website, which is the LGBTQ Center of Durham.org. It's a very long domain, but it works.
You're getting shout outs about your photography
Oh,
as
thank
well.
you.
And I know another comment is thinking how I'm thinking, how how to have you become more involved, and how can the different coalitions in this space be more involved with your work. So we are the North Carolina Serious Illness Coalition. We work really closely with the North Carolina Coalition on Aging. And Mary Bethel has the comment, there is the LGBTQ plus subcommittee of our Health Equity Committee. The subcommittee is currently doing a survey to try to find how aging providers are working within the LGBTQ plus community. So I'm not sure if that's a question there, or there's a survey that we want to make sure that we get to you and that you can help to. I think that's looking at, and Mary, you can clarify if that, I think that's the healthcare providers and which.
It's actually agent service providers. Yeah, I was just putting it in there as a FYI so that people know um, that that I think there's a lot of interest in programs and working with the LGBTQ community.
Great. And so that's one way I think we can work together, because as we have a few minutes left, and I'm trying to think of other ways that we may be able to do more together. How can members of the coalition, especially when we talk about social justice and health equity issues, um, as we're looking within the serious illness space and being proactive for both patients and caregivers, how can we be more proactive to advocate within the LGBTQ space and to be more supportive of the coalition, your work with our coalition efforts there?
So one of the big things that comes to mind is because I do organize queer health fairs twice a year, and the big premise of that is having free and or reduced cost services available to folks either on site or at their convenience. And one of the things I really would love to start working on, thank you, Shane. One of the things I would love to start working on is creating a statewide programming around that, where there's like at least a resource list of like different services that are like incorporated into the communities, with like free services that they can provide. Like say if it's like a mobile health exam unit that can be for LGBTQ plus folks, like say if it's a medical students, and they're getting their training hours and they're able to come out in a mobile unit and provide like physicals and evaluations for free. So those are the kinds of things I really would love to start expanding on in 2024.
I just had such an idea. And yes, the fairs are wonderful. I have attended in the past.
Awesome.
Wearing my shirt, which I love my shirt. I wear it all the time, not just for today, but I especially wore it for today. We have a number of educators within the space of the Serious Illness Coalition, as well as some partner projects that are that support folks in filling out their advanced care directives and their healthcare proxies and their living wills. And that let's talk offline about that. And as of last week, I went to Durham Tech and I passed the notary course. And so now I can help notarize those documents for people, which is still required here in North Carolina. So let's talk
about those type of resources that I absolutely like want to have available to folks. It's like, hey, are you needing a notarized letter? You can go to these folks and it'll be affirming and non-judgmental space. And yeah, that's exactly what I want, especially from hearing what folks have communicated with me whenever they come to our healthcare events, or even just like stopping by the center. They're just like, I came here to Durham from XYZ because we don't have these things available. Or I'm afraid to go to like this place or this place or this place because I don't know how I'll be treated. Or I don't know if they'll dead name me, or all these things. And I'm just like, yes, these are definitely the resources like I want to bring to the scope of what care is, because health and wellness goes beyond physical, and the physical, mental, emotional. It's like this is an all around holistic approach.
As I think about it, and I know we only have a few minutes left, and we were just talking about
and be a sponsor of the fairs. Thank you, Shane.
Yes, well, unfortunately, we need our own sponsors, so we can. But I was thinking there are things on the individual level. The one superpower we have a few superpowers at the North Carolina Serious Illness Coalition, but the one thing that we do well is convene. We create platforms and we convene. We talked at the top of the show about the Joining Our Voices symposium that's happening next week. But it strikes me, as we think about working together and thinking about these issues, what advice do you have for the Serious Illness Coalition as we create spaces to talk about key issues? And we generally have a virtual presence. We have this, we have other events, and we have our website. I don't know why I'm using my hands. What do you feel are the big topics that you wish, or even the small topics that you feel that people should be talking more about? And this could be helpful for us, even as we're doing our planning, but what do you wish people were more aware of? What are the questions that you're generally getting that it's like, we need to do more, we, the collective, we, on getting out more information, advocacy about X?
I want to say basic healthcare rights for folks, even just as something as like, it seems basic to us, but it can be life-changing to others. So a fresh pair of glasses, getting an eye exam, getting dental care taken care of, like even if you go several years with unchecked oral care, that can lead to so many other negative health outcomes, including cardiovascular disease. And I believe infections, and I think also like chronic sinus problems. And so there's so many of these things that are linked on just being able to provide a basic human right. And I think it can be intimidating for folks. And sometimes we don't know why. Sometimes that can be stemmed in trauma from previous experiences. And so in conjunction with being there and having the presence, I think that the important part is asking the real questions about what does that look like for you, and why like asking why, like why has this steered you away before? And frequently we'll see that there's a lot of trauma incorporated with like institutional trauma, medical trauma, provider trauma, and historical trauma, and a distrust in institutions. So I think even just being able to like open up and ask the why, and being very intentional with sharing those spaces with folks who are living in those experiences and living in their truths, it creates trust. And that's what a lot of it boils down to, is building a bridge of trust by, yes, being there, but also being present and listening and asking the important questions and figuring out what those important questions are.
Well, Hunter, thank you so much. We are at the end of our time. So
I did get a question I wanted to make sure I answered. So there's a
okay.
question about the next health fair. So the next health fairs are March 10th, 2024 and October. I'm trying to access this in my brain. I believe it is October 16th, 2024.
Okay. Well, so the one that's coming up in March, which is we're saying coming up, that's still a few months away. So let us know, and we can make sure to promote it on our newsletter. And then maybe there's some ways we can be more directly involved. And I wanted to say some fun, loving thank you and goodbye in the sense of, you said why. Well, why haven't we done more together? But you know, so here it is, March 10th and October 13th. So anyway, Hunter, thank you so much for joining us on Friday Facts. I think there's a lot more we'll do together, and really appreciate all that you're doing. We're in close physical connection. So thank you for what you're doing in the community, and thank you for what you're doing with the community in the largest way. Many thanks.
Thanks, y'all. I really appreciate being here.